Good morning. My name's Umutoni Kanuma Sharon. I'm going to be discussing about the project called Employ Healthcare Human Resource, which is a goal, and the project is called Approaches to a Healthcare Career. So I'm going to be explaining a variety of uh, career pathways in healthcare industry. So starting, I'll be talking about healthcare overview. And when it comes to health careers, it is where we find that it covers most of occupation, let it be in the therapist, assistants, and the personal care aides, since they are part of the Bureau of the Labor Statistics healthcare job list. For the option of opting in for a healthcare career, it depends on the personal preference or interests. So there are many different ways in which the individual might want to work directly in the patient's, either acting as a physician working in healthcare, since there will be the healthcare services demand as the number of the baby boomers will be increasing. So the jobs available in healthcare is about the clinical care, which deals with working with the patients directly, and apart from that, there are other non-clinical options in the healthcare industry like medical records, medical transcriptions. So let's talk about the three non-clinical healthcare jobs and necessary education and skills needed to work in that non-clinical healthcare. So talking about the non-clinical education and skills. About the education in healthcare, the required career in healthcare range from high school diploma where someone acts in care aides, associate degree like in radiation therapist or radiologic technologist. There are also bachelor's degree where someone acts as a therapist to the masters, and the doctoral degrees where someone acts as a nurse, doctor, and therapist. Someone may work in the healthcare industry uh, when she or he is having only a certificate or non-degree award to be allowed to do some jobs in the healthcare field. So there are types of jobs and education level and skills. Talking about medical secretary, this is a good position for a person who have an advantage of uh, an advanced education with a bachelor's degree, since the medical secretaries are needed in different areas regarding to the healthcare industry. The basic skills is that uh, there is needed or there is performing, coordinating the office activities, storing and retrieving and integrating information to the staff and clients. About the medical transcriptionist, these are workers that are in charge of listening to the dedicated recordings made by physicians and other healthcare professionals and transcribe them into the medical reports, which become part of their patients' files. So they include it in the patient's file. And to be hired, a transcriptionist must have completed post-secondary training in medical transcription or a 2-year associate degree with good English grammar and punctuation, since he is in charge of uh, transcribing and recording, listening. So English and grammar has to be part of his skills or her skills. And moving forward with healthcare administrator, this is also another good paid job where someone earn almost $1,000, $100,000 per year. So, and about becoming a healthcare administrator, most of the employers require for a master's degree in healthcare administration. The main required skills include focusing on ins and outs that makes the healthcare system or hospitals function effectively by having strong background in both management and healthcare. So, talking about allied healthcare professions. Allied healthcare professions normally are the segment of healthcare that intervene in delivering the services, including the identification, evaluation, prevention of disease and disorders, rehabilitation, and healthcare system management. Allied healthcare profession is divided into two broad categories, which include technicians, uh, those known also as assistants, who are to perform procedures with a 2 year education, and therapist technologists. Another category is that of therapists, or who involve in acquiring procedure skills, uh, evaluate the patients, they diagnose condition and develop the treatment plans. However, about these allied healthcare professions, there are 6 examples of that are related to those uh, health professions from the two categories, and they include cardiovascular technicians. These are people who use many procedures and instruments to diagnose and treat heart diseases and vascular problems. They more required in the hospitals. The expected level of education is associate's or bachelor's degree in appropriate field, which goes with that cardiovascular system. Another example of allied healthcare profession include ophthalmic medical technician. So this is also known as an allied ophthalmic personnel, where they are called the ophthalmologists. They are eye doctors, in other words. This is related to the provision of patient care by performing eye-related clinical tests, like recording patients' medical histories, in conducting vision and diagnostic tests, etc. And moving to the third part of the allied health professional example, it's medical assistant. This person performs administrative and clinical tasks in the office of a physician. So these people do not need to be given certificates, but to certification means that someone is experienced and had a formal training. So the fourth example is anesthesiologist assistant. Sometimes these terms are hard. So this person is in charge of providing the assistance to the anesthesiologist in treating the patients before or after the surgery, which is accompanied by the comfort and well-being of the patient. So these people help in helping those patients who had the surgery or who are ready to go for the surgery. So about their education, this person is supposed to be having a master's degree, because that's a very strong part that someone has to be working on. And in other words, it might even cost someone's life. So you need to be having good skills and ready always to help. So the fifth one is neurodiagnostic technologist. This person uses special. This person, he uses its specialized equipment to see the normal and abnormal electrical activities in the central, automatic, or peripheral nervous system of the patient. So this person, after identifying, so he or she has to provide variable data that will be used by the physician to diagnose and be able to treat. So after he has identified what's going on with the patient's nervous system, that's when he or she can make like a report and then pass it to the physician, so that they can know what's happening to the patient. The last example of allied health option is pathologist's assistant. This is a trained person who provides anatomic pathology services and perform all the surgical and autopsy functions of a pathologist, leading to a diagnosis. So this person does a lot of clinical practice. So those were the six examples of the allied healthcare option. So looking at the levels of nurse, and education requirements and job requirements, let's start by what is LPN. LPN, in full words, it's licensed practical nurses. So about their education requirements, they provide basic nurse care and work under the direction of registered nurses and doctors. So for someone to be part of this employment, education program has to be studied for almost 1 year, licensed practical. So it means that this person has to be have studied for almost 1 year in this field of education. And about the job, since there is an increased rate of baby boomers, there will be the need of many nurses who will be providing healthcare services. So she or he with these skills can get easily the job. Another one is called RN. This is registered nurses. About their education journey, there has to be 3 paths, including diploma in nursing, a bachelor's degree, associate degree, and then a bachelor's degree in nursing. So that makes their education journey. And about the job, it is in charge of providing and coordinating patient care by educating the patients about their health condition, providing emotional support to those patients, and even including their family members, because sometimes you find that there are families which can't deal with their relative when, like, to see him or her suffering. So they have that responsibility of providing and help them emotionally. Another one is NPL. It's nurse practitioner level of nursing. So about these some of the specialized education include clinical training that allow levels of care. Some of those education levels include an associate or bachelor's degree from an accredited institution of higher education, or a diploma from approved vocational training program. So focusing on the job area, there has to be some education levels, and in addition to that, the individual has to know how to address the different patients' problem, like get involved so that you can know how to solve the patient's problem, and also working with a medical physician's team. So that person in charge of NPRL has to find a way of getting used to the patients so that even he can work effectively with the physician teams. And how another one is working effectively and efficiency. So this was all about my presentation. Thanks for following.